Chapter 31, Drugs Used to Treat Oral Disorders. So this is a fairly short chapter, more so focusing on the disorders in the oral cavity, and there's not really too many medications. In review, we're going to talk about mostly cold sores, canker sores, candida, plaques, eczeratoma, halitosis, and mucositis. Cold sores, aka fever blisters, are not caused by a cold or a fever, but they're actually caused by the herpes simplex virus. They are generally located on the lips. It's estimated that at least half of all Americans between age 20 and 40 have cold sores, most being infected before age 5. There are remissions and outbreaks. Outbreaks are generally preceded by a prodrome of symptoms such as burning, itching, or numbness prior to the formation of the lesion. Fluid-filled vesicles or blisters develop, and those are associated with pain, sometimes a fever. The fluid from the vesicle contains the live virus and is contagious and is transferred from person to person through direct contact. These sores generally last 10 to 14 days. The goal of treatment is to control the discomfort, allow for healing, and prevent the spread from to others. Canker sores, also known as apoptosis stomatitis, affects 20 to 50% of people in the U.S. The cause is unknown, but it's thought to be triggered by stress, local trauma, irritation such as toothbrush abrasion, braces, or biting of the inside of the cheek. They are not viral, they are not contagious. Symptoms generally last 10 to 14 days and can be so painful that patients don't eat or drink. Chemotherapy and radiation can also trigger canker sores. These are generally treated with anti-inflammatory agents. Topical apothosol is one of the agents. It gets applied 4 times daily. It's a paste. Other things that people apply are benzocaine or some sort of numbing agent, some sort of oral agents can be taken as well, such as ibuprofen or Tylenol. Which oral disorder is contagious? Well, the answer was cold sores or the herpes virus. Candidus. Candidus albicans is a fungal infection and is the most common oral infection. It's also known as thrush, generally caused by a depressed immune system, and the fungus is able to kind of take over in the mouth. This is characterized by a white milk curd plaque in the oral mucosa. It's treated by nystatin generally. Let's see if I can do this. Sorry. Nystatin. Nystatin is generally either a swish and swallow, or you may see a swish and spit. Think about when you are giving patients nystatin, you want to not give it prior to a meal. You want to give it after all their medications so that it has the ability to kind of coat their mouth and stay there. The other thing that you may see given for candidus is clotrimazole troches, and these are these are troches that they actually kind of suck on, and it also coats their mouth. You generally see candida with antibiotic therapy. Also may be seen with patients who are receiving chemotherapy or who are malnourished or have malignancies. Think about what inhaled medication we ask patients to rinse their mouth out after to prevent candidus. It was the steroid inhalers, so that also can put a patient at risk for candida. Mucositis is a general term used to describe painful inflammation of the mucous membranes in the mouth. It's usually associated with chemotherapy or radiation. It develops 5 to 7 days after chemotherapy or radiation treatment. Candidal infections are often present after the after they receive their therapy. They can be severely debilitating. On page 485 in your book, table 31. The WHO shows you the WHO mucositis scale, which reviews the grading system. You don't need to necessarily know each of the grades, but just be aware that grade 0 is there's no mucositis present, and it works its way all the way up to grade 4, where they're not able to take anything in by mouth because it's so painful. This, you can see a picture here. It's generally associated with erythema, ulcerations, some white patchy mucous membranes. Sometimes it also has some candida involved in it as well. A patient undergoing chemotherapy for cancer has developed significant mucositis. Which technique may bring relief to the patient? A. Frequent oral rinses with commercial mouthwash. B. Use of viscous lidocaine. C. Regular toothbrushing. Or D. Sucking on hard candy. So the answer is B. Viscous lidocaine. Viscous lidocaine can be used to provide an anesthetic effect in the mouth. It may be used before meals to help them eat better with decreasing pain. You do not want to give a patient with mucositis any sort of mouthwash because it has alcohol in it, and that will further irritate the oral mucosa. Regular toothbrushes should not be used with acute mucositis because it will also further irritate it, and hard candy also irritates inflamed tissues. So mucositis is generally treated with oral viscous lidocaine, which kind of numbs up the mouth. Plaque. So plaque is the yellow-white substance that builds up on the teeth and the gums. It originates from the saliva. It is the primary cause of tooth and gum disease. If it's not removed, it breeds bacteria, and this bacteria secretes acid that eats away at the teeth and causes cavities. So how do we get rid of plaque? What's the treatment here? Brushing of the teeth, oral hygiene, and mouthwashes are how we're going to take care of that. So promote frequent oral hygiene. To prevent further oral problems in children, when should regular oral care begin? A. At infancy by rubbing the gums with gauze to clean. B. When teeth first erupt. C. When the child is old enough to hold a toothbrush. Or D. When the child enters kindergarten. So the correct answer is B. By cleaning newly erupted teeth with a gauze or very soft bristle toothbrush, parents can begin their oral care regime to help protect against dental caries. So halitosis is a fancy medical term for bad breath. It's treated by eliminating the cause. Some common causes include smoking, some certain foods. If the cause cannot be determined by the dentist, if the cause cannot be determined, then the patient should consult their dentist because it could signify an underlying pathologic condition. Exeratoma, this is a fancy word for dry mouth and is generally treated with artificial saliva. Dry mouth can increase tooth decay, so you definitely do want to treat that. The nurse practitioner is caring for a patient who is experiencing exerotomia. Which type of treatment does the nurse prescribe for the patient? A. Antibiotics. B. Saliva substitute. C. Antiviral ointment. Or D. Surgical removal. So keyword here, exerotomia, and if you know what that is, you know it's dry mouth. So the correct answer is going to be B. Saliva substitute. Dentifrices is basically just abrasive agents that are used in toothpaste. They're foaming agents that can be abrasive, and they're used to remove plaque. Some paste has additives such as peroxide for whitening or fluoride to prevent cavities. The therapeutic outcome of this is to reduce the plaque formation and cavities, as well as providing a pleasant, fresh taste for the patient. And then mouthwashes are used to kill bacteria in the mouth, prevent halitosis, generally used for patients who have undergone oral surgery or facial trauma. The therapeutic outcome for this is to temporarily reduce bleeding, irritation, relieve discomfort, refreshing taste, and improvement of halitosis. You may see in practice chlorhexidine used that has an antibacterial effect in the mouth. There's also fluoride mouthwashes to prevent cavities, and zinc mouthwashes which decrease bleeding and irritation. How long does the breath freshening action of over-the-counter mouthwashes last? A, 10 to 30 minutes, B, 30 to 60 minutes, C, 1 to 2 hours, or D, 3 hours. So the answer is A. Over-the-counter mouthwashes are meant to freshen breath and rinse out debris and typically last about 10 to 30 minutes. They are not meant to be a substitute for thorough oral hygiene. So remember the toothbrush and the abrasiveness that you need to actually wipe the plaque away.